Hello, it's Chloe Bruce, the gas journalist again. I've talked in previous videos about my diagnosis of schizophrenia in the UK and some of the socio-economic problems associated with mental health. I thought it might be interesting for people, at least some people, what it feels like when you first become psychotic, because my condition, like maybe many, started off as just psychosis, and then later on it was considered to be schizophrenia, which I think is a way of saying a more chronic mental health condition. And I want to say I've never, it isn't anything to do with hard drugs. I wasn't on any drug at all at the time. I haven't ever been a cannabis smoker. I will say that at 14 years of age I was at a party and given a joint, and it didn't really agree with me, and all I remember is the next day as I felt utterly depressed, and I thought I'm never doing that again, and luckily I didn't. Although I have had a smoking addiction, which I'll talk about when it comes to some of the nitty-gritty of mental health. I don't smoke these days, and I'm glad of it, but I have taken up smoking as a way of easing the pressure, and I'll talk about that in other videos about this sort of mental health journey. Anyway, so I'll start by describing the context in which I developed psychosis for the first time. This was at the age of 26 and a half. So I was working as a journalist in Vienna in a new job and was really enjoying it. I also felt that I had a good quality of life out there and was enjoying my evening class in the German language. I came down with a chesty cough but had to keep working as I'd only just started my job and was on a probation period as such. Under this law, you can be dismissed after 3 months in the case of this particular employment contract if you have not made the grade during this period. Fortunately, I managed to work even with this chesty cough and was invited to stay on in the company. However, for some reason, out of the blue, I remember lying on my bed in Vienna and just thinking, I just want to stop. I want to get ill. Maybe I could just stop eating and stop that way. Fortunately, I've never had a significant eating disorder, but I developed insomnia, which is extremely rare for me. I can usually sleep for Britain. The company was moving the whole team back to London, and I was anxious about this, but was not sure why. Back in London, I have to point out I'm British by nationality, and I went out to Vienna for the job. So back in London, the company put me up in a hotel for a month while I searched for somewhere to live. I was lying in my bed in my hotel, in central London, when all of a sudden all I knew was I had such extreme terror that I had to call the police about a rape. Now I will point out that I was sexually assaulted in my late teens. Bear in mind I'm getting into my late 20s at the point of this psychotic episode. But in actual fact, in my late teens, I was sexually assaulted by a man, and I have never really addressed this issue. I had told one psychiatrist, but informally, not in a session, but in an informal context, about this sexual assault. And he upset me a lot because he said, sometimes women have to do these things. You should be his little friend, sorry, but sometimes women have to do these things. I felt he said this as though I should become some kind of prostitute, because he had actually become quite overexcited about the money side of things. Because I had told him that I had actually declined money from this man for sex before he had assaulted me. In other words, he offered me money for sexual intercourse, I refused, and then the sexual assault took place. I have described in previous videos how one thing leads to another. That is, if someone has already been abused, they're more likely to be abused again. The police were very nice to me when I called them and said that mental confusion was often present when a victim addresses the assault they've endured. In other words, what they said exactly, I think this is something like if someone's raped, they're always in a mentally confused state about it. As they try and describe it, it comes out all kind of higgledy-piggledy and confused. Anyway, the police told me, they were very nice to me, but told me to see a doctor, and I was referred to a psychiatrist who said I was psychotic, although at that time he did agree my only symptom was extreme preoccupation, which I've discussed also in similar earlier videos. Throughout all this, I had to keep going at work, but suffered horrific side effects because of the medication I was given. I took, I think in all, 5 weeks of work in the whole year I was working there because of the medication mainly. I was not offered any psychotherapy by psychiatry, and indeed no UK psychiatrist has ever referred me for such therapy. I kept going for a year before relapsing and entering psychiatric hospital for the first time, and this hospital was Queen Mary's Hospital in Wandsworth. I went in as a voluntary patient, because I said earlier that I was too frightened not to go into hospital. I had such terrible fear that I just thought the best place for me was in hospital after all, just to get it over with. And it was there in Queen Mary's Hospital that I was first diagnosed with schizophrenia. I will discuss this in a later video when I discuss Queen Mary's Hospital. It can be an extremely long journey when you have a mental health problem, as I've said before in other videos. But I do feel, certainly in my case, I feel that I can emerge from it and have emerged from it at the other end with a really decent quality of life. But it is maybe something you have to be extremely aware of. You have to maybe, I'm not saying this about other people, but I personally had to address all kinds of issues, and I got lucky that my epilepsy was diagnosed a bit later overseas. But it has been an extremely long journey. I'm older and wiser, but I never really thought that I would feel well again within myself, and I feel extremely well now with a decent quality of life, although I do have what people will see as psychotic symptoms such as hearing voices. Thank you.